Hello, my friends. It is Dr. Darla from Cellmate Clinics. Today, I want to talk about some of the other health concerns that can be addressed by utilizing vitamin K2. If you look back at one of my previous videos, I talked a little bit about vitamin K1 versus vitamin K2. Go check that video out to get more information on that. But I really want to kind of hit all the different areas that vitamin K has been studied and shown to have improvement in terms of health and longevity. So vitamin K2 is a very well-studied nutrient. There's a lot of studies out there discussing the benefits of them and really understanding the mechanism of action and how vitamin K works to help us achieve overall health. So we know from studies that the risk of diabetes is decreased by about 20% by utilizing vitamin K2. We know that having a higher amount of vitamin K2 has been shown to decrease the risk of cancer and in both the development of cancer and the dying from cancer. We know that we have a reduced risk of prostate cancer in men by about 35% when we are utilizing vitamin K2. We have an increased amount of perfusion, energy balance, and microcirculation. All of those are increased significantly with the use of vitamin K2. What does that actually mean in real people terms? Real people terms means we have better circulation, better oxygenation, better performance, better energy. Vitamin K2 also functions in muscle contraction. So for people who are having seemingly random muscle cramping, can benefit from utilizing vitamin K2 because of the way that it supports the proper muscle contraction. So other nutrients that are thought about in terms of muscle cramping are magnesium and potassium, but don't forget about vitamin K. Vitamin K2 also helps to revive dead and dying nerve cells. What does that mean? Peripheral neuropathy, pins and needles, numbness in your fingers and toes can be caused by a vitamin K deficiency. And if there's nerve damage that is caused by diabetes or by vitamin B12 deficiency or from a structural issue, an injury in the low back, then in repairing and regenerating those nerves, vitamin K2 is shown to really help that in rejuvenating, regenerating those dying nerve cells. Other things to think about in terms of nerve cells are things like the neurodegenerative diseases such as Alzheimer's or Parkinson's or dementia. And so when people come to me and they ask, what is one of the things that I can do to kind of help prevent this? It's in my family history. I'm really concerned about it. Vitamin K2 is one of the nutrients that can really be utilized to help rescue and repair those dead and dying nerve cells that are associated with those types of diseases. We can also have an improvement of energy. So when we think about energy, we think about the powerhouse of the cell, the mitochondria. Mitochondrial dysfunction is a super fancy term used for low energy situations, and it's a lot more complex than that, but I just want to keep that simple. There is a electronic transport chain that is supported by vitamin K2 that helps to rescue the mitochondria that is kind of being strangled or deprived of oxygen due to a vitamin K deficiency. So in terms of longevity, metabolic health, improvement of quality of life, improvement of athletic performance, improvement of circulation, modulation of your immune system, vitamin K2 definitely has a role in that. When we think about oxidation, so oxidation is a term that it's I don't know, I explain it a lot, like if you put a pipe outside and it rusted, that's an oxidation process, and there's a similar process that goes in our body every day. And so that's where we get things like antioxidants. So vitamin K has an antioxidant role and helps to replenish and helps us to control the creation of ATP, which is the energy that gets created from the mitochondria. So how can that help in terms of aging? Because the mitochondria gets slower and kind of stops producing energy, which also decreases the amount of circulation. So things like muscle tissue gets depleted of oxygen, and we get into a muscle wasting type of situation. So people who have chronic diseases will have muscle wasting, but also sarcopenia is the medical term for age-related muscle weakness, or muscle, like losing your muscle mass. Vitamin K2 can help that. So as we are aging, we need to really be thinking ahead. How do we prevent some of these things that can really impact the quality of life and our ability to take care of ourselves as we're continuing to age? Muscle strength and bone strength are two of the biggest things that are impactful for allowing people to maintain as much independence as possible while they're aging. And many of you may not be quite in that frame of mind of thinking, when I'm 70 or I'm 80 years old, I would like to be living on my own versus requiring assistance to live. But I would encourage you to begin thinking about that now, because if you wait until that becomes a problem, it's much harder to fix. It's easier to prevent than it is to recover. So I would encourage you to think about that. Also, in terms of cardiovascular function and output, vitamin K2 is really, really important in keeping the heart healthy. In fact, one of the major markers of cardiovascular risk and cardiovascular disease is an arterial calcium score. And that is it's considered to be one of the best predictors of cardiovascular disease. Studies have shown that vitamin K2, because of how it interacts in pulling that calcium out of the arteries and pushing it to the bones, not only improves bone health, but also decreases your arterial calcium score. So if you have an arterial calcium score that is concerning, then definitely think about vitamin K2 as part of that treatment plan, in order to decrease the amount of calcium that is stored. Oftentimes what we get told when we go to our cardiovascular doctor is like, oh, okay, well, your calcium score is high. You need to, go on a statin, or you need to have a blood pressure medication, or you need to have this, that, or whatever. But what oftentimes does not get discussed is, are there nutrients that we could add into the diet that would prevent us from having to utilize these medications? And I don't want to get too deep into it, but cholesterol medication really does very little to prevent your risk of heart attack or to prevent dying from a heart attack. In fact, there are books and whole studies that are dedicated to that. And I'm gonna pull myself back here so I don't get too much on the soapbox, but just understanding the way that vitamin K2 works to pull that calcium out of the arteries and push it into the bones is very, very beneficial in decreasing the risk of cardiovascular disease. It also increases the amount of circulation. And so we get what is called perfusion and oxygenation. We get increased levels of that. And we also get an increased level of cardiac output. So if your cardiovascular output is low, or you're concerned about that, or you're having trouble when you're exercising and you're getting out of breath, one of the things that can be related to that is a deficiency in vitamin K2. So vitamin K2 is utilized in the anti-aging world. And thinking about longevity, sometimes when we hear anti-aging, we think it's a bunch of vain people that are worried about the wrinkles on their face. But really, if we dig into anti-aging, what we're thinking about is, how do we prevent some of these diseases that we're seeing overtake our population as we are getting older? And so cardiovascular disease being one of them. How do we prevent that? How do we decrease the risk of death and dying from cancer and developing cancer? And vitamin K has a role in that. How do we decrease, as men, how do men decrease their risk of prostate cancer? Vitamin K has a role in that. How do we decrease our level of blood sugar issues? How do we better our metabolic age? How do we increase our bone strength? How do we make a heart that is super healthy? How do we improve our muscle mass? All of those things are affected by vitamin K, specifically MK7. So I just want to share that with you so that you have that as part of your thought process, is how do I prevent these types of diseases, and what are some of the most beneficial tools to do that as I'm going through the process of living, and as I'm going through the aging process, right? Women that are moving through perimenopause and menopause, this is the time to start thinking about that. Well, actually, the time to start thinking about that was when you were 20, but let's be honest, we weren't thinking about any of that when we were 20. But now that we're a little bit older now, we want to know. And